Ask the client to urinate since an empty bladder makes the assessment more comfortable. Ensure that the room is warm since the client will be exposed. Assemble all necessary equipment, examining light, tape measure, skin marking pen, and a stethoscope. Introduce yourself and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how the client can participate. Discuss how the results will be used in planning further care or treatment. Perform hand hygiene and observe other appropriate infection prevention procedures. Provide for client privacy. Inquire if the client has any history of the following: incidents of abdominal pain, incidents of constipation or diarrhea, blood or mucus in stools, stomach ulcer, gallbladder surgery. Assess the client to a supine position with the arms placed comfortably at the sides. Place small pillows beneath the knees and the head to reduce tension in the abdominal muscles. Expose the client's abdomen only from the chest line to the pubic area to avoid chilling and shivering, which can tense the abdominal muscles. Inspect the abdomen for skin integrity, uniform color, unblemished skin, no scar or surgery. Inspect the abdomen for contour and symmetry. Observe the abdominal contour while standing at the client's side when the client is supine. Ask the client to take a deep breath and to hold it. Assess the symmetry if contour while standing at the foot of the bed. If distension is present, measure the abdominal girth by placing a tape around the abdomen at the level of the umbiculus. Observe abdominal movements associated with respiration, peristalsis, or aortic pulsation. Auscultate the abdomen for bowel sounds, vascular sounds, and peritoneal friction rubs. Warm the hands. And the stethoscope diaphragms. For bowel sounds, use the flat disc diaphragm. Ask when the client last ate. Place the diaphragm of the stethoscope in each of the 4 quadrants of the abdomen. Listen for active bowel sounds, irregular gurgle noises every 5 to 20 seconds. For vascular sounds, use the bell of the stethoscope over the aorta, renal, iliac, and femoral arteries. Listen for bruits. Peritoneal friction rubs are rough, grating sounds like two pieces of leather rubbing together. Friction rubs may be caused by inflammation, infection, or abnormal growths. Percuss several areas in each of the four quadrants. Tympani over the stomach and gas-filled bowels. Dullness over the liver and spleen. Perform light palpation first to detect areas of tenderness or muscle guarding. Systematically explore all four quadrants. Ensure that the client position is appropriate for relaxation of the abdominal muscle. Light palpation. Hold the palm of your hand slightly above the client's abdomen with your fingers parallel to the abdomen. Depress the abdominal wall lightly about 1 cm. Move the finger pads in a slight circular motion. Note areas of tenderness or superficial pain, masses, and muscle guarding. Watch facial expressions. Palpate the area above the pubic symphysis if the client's history indicates possible urinary retention. Document the irrigation and the client's response in the client record using forms or checklists supplemented by narrative notes when appropriate. Electronic health records will be used as a designated wound skin documentation sheet. April 9, 2021, no bowel movement for 20 hours, ate 75% regular diet yesterday, abdomen is flat, active bowel sounds in all four quadrants, tympani above umbilicus, dull below, no muscle palpated.